Good morning, everyone. This is Chris Fraser. I'm the Chief Operating Officer at Westside Family Healthcare and the Vice Chair at Christiana Care Home Health. I'm pleased to welcome you this morning, along with my co-chair, Kathleen Purcell from the Wilmington Senior Center Executive Director. This is our Social Determinants of Aging subcommittee. And we also are examining, as part of that effort, racial disparities and health equity. And appreciate you all being here this morning. As we were getting into the meeting, we're all talking about giving thanks and the opportunity that we had to connect with our loved ones over the past holiday. And this is a very special time of year, and appreciate you all taking the time out of your busy schedules on a Monday to meet. We are going to keep the meeting, like we had said, to an hour today. And in a little bit, we'll review our agenda. It would be great if we could all go around and introduce ourselves. This meeting is being recorded, as you all know. But for those of you who may view the meeting later, if we would start and go around the room and let us know who you are, where you work or volunteer, and anything else that you'd like to share as a welcome this morning. And Carolyn, we could start with you. Good morning. Thank you. Not to put you on the spot, but you're the latest to pop on. So good morning.
I'm sorry I was late getting to the meeting. I'm Carolyn. I'm the director here at the Modern Maturity Center in Dover.
It's wonderful to have you. We are all getting ourselves together. So having you here is wonderful. And we just started. So thank you.
Okay, thank you.
Yeah. Allison?
Yeah, hi, I am the owner actually of the Wilmington Homestead. So Robert and I are strong representation today on the Homestead front, but I'm the owner of the Wilmington office.
Excellent. Good morning. Well, let's turn, Robert, to you, Mr. Ware.
Yes, Robert Ware, the Homestead owner in Dover, Delaware. So happy to be here.
Wonderful. Thank you. That Rob saw that. Mr. Latin.
Rob, thanks so much. My name is Rob Latin. I'm the Director of Government Affairs for Bayada Home Healthcare and the Legislative Chair for the Delaware Home Care Association.
Thanks so much for being here. I know you've been participating and we've all been joining in, whether from the road or now at a good spot at the home or in the office. So it's wonderful. Lisa, thank you for joining. Good morning. We're good. I can't hear you yet. I think you're still on mute.
Okay. Can you hear me now?
Yes.
Great. I'm Elisa Clark, the Director of Social Services for the Wilmington Senior Center.
Lisa, thank you so much for being here. We just started with introductions and then we'll go through our agenda. And Melissa, turn to you.
Hi, good morning. Melissa Smith, Director of the Delaware Division of Services for Aging and Adults with Physical Disabilities. Glad to be with you all this morning.
Thank you. We do have some excellent team members and staffers on with us helping make this meeting go and who have been working with us. Anthony, we'd love for you to introduce yourself.
Hi, everybody. My name is Anthony Bernadzikowski. I'm the policy analyst for the Delaware State Senate. We're also joined by some folks at DTI who are graciously helping us out.
I muted myself. We want to acknowledge Will Leskis as well, who's been helping move us forward. And I think representing DTI today. Is that correct?
I apologize. I think that may have been a misunderstanding on my part. I think when I heard the voice of the person from DTI, I thought that was Will.
Oh, okay.
So I apologize.
All right. Well, many of us have seen correspondence from Will and Caitlin and Anthony from you helping us to move forward. So I want to say thank you. And at DTI, thank you to you and helping support. Okay. Well, let's go through our agenda for today. We had a meeting that we did try to drive forward on November 10th, and apologize some of you, we weren't able to all be together. And this is a bit like they say, herding cats of trying to get all of us together at once, but this is great to see all of you. We have some minutes from that meeting We'll also do a little bit of report out on our November 22nd meeting. We are going to go through what some of us had a chance to respond to as a survey that we had put together, and then we're going to have some discussion on that. And our goal, one of our goals that we've defined or been given as a task, is to make sure that we are considering the social determinants of health and racial disparities and health equity as we're looking to bring forward recommendations. And so we've had some dive in and discussion on that, what we might define as social determinants of health. I'm gonna here bring up what I have from our minutes from November 10th and give you all an outline. We started that meeting, we reviewed some materials that were brought to us on the social determinants, had some discussion on how those social determinants affect aging well, and worked on what our list for discussion should be. Like we had done in that last meeting, and I had mentioned, we sent out a survey so that we could prioritize where we think we might need to focus, and also some impact on how our state is doing with those. We had some great input from members of the community, Miss Dash, and also Miss Spencer, who are clients at the Wilmington Senior Center. And this really gave us some good help and direction from their experiences. So that's a quick summary of the minutes. I'm gonna stop right there and ask, does anyone have any comments or corrections on the minutes? Those were emailed out, I believe, from Will, and you should have a Word document. Okay, so I'll ask, do we have a motion for approval of the minutes?
I'll move to approve.
Thank you, Melissa. Do I have a second?
Second.
Rob, thank you. Okay, all in favor?
Aye.
Thank you.
Aye.
Anyone
Aye.
opposed? Okay, thank you. All right, so the minutes pass. Let's have, is there any other discussion on the minutes? If not, we can move on. So Anthony, if we could go to the next slide, please. Great. So here's our report from the chairs for the November 22nd meeting. I am one of the chairs, and unfortunately, I was not able to attend that meeting. Kathleen, I think, has maybe some delays in joining us. But from those of you who were at our larger work group meeting, could we hear your input? Anyone have some comments from that meeting?
I'll volunteer to get us started.
Thank you.
Certainly. I think one of my biggest takeaways from the report out and the conversation after all of the subgroups had an opportunity to discuss amongst themselves is the incredible amount of overlap, which of course we would expect. But I think as we look at our list of prioritizations and then also consider those issues that are cross-cutting across groups, that might be one of our next steps, is to decide where those cross-cutting issues fall in terms of the subgroups and who's going to take on what. For example, services for aging, I think, are inviting transportation to their subgroup and maybe absorbing that. So that was a takeaway from me, and just that there was incredible synergy across the groups and that there's really alignment and agreement on the issues facing Delawareans, but also solutions. And so I think we're in a good place with the list, but also, kind of that task at hand of who's going to take these issues that seem to go across. And I'll bring up workforce as another issue that certainly came up in every single subgroup. So I'll stop there and give others an opportunity to kind of weigh in on their takeaways.
Thanks, Melissa. Other input? Well, one of the things that, as I chatted with Kathleen in preparation for this meeting, she's, thank you for that, Melissa, you reminded me, she shared a similar comment, and it seemed that was one of the things that the senator was also perhaps driving, as well as we look at our subgroups, where we might say this makes sense for us to focus and not overlap as we look to develop recommendations. I think we see that too as we'll get into our survey and what we think for our group is important. Okay. Any other thoughts from the November 22nd meeting? Okay. All right. Anthony, can we go to the next slide, please? Okay, so let's just dive in. We did do a survey. I think we had at least 6 of us who responded, and we looked at what the list of social determinants of health that we had put together. I think on our next slide, Anthony, if we go to that, here we have our results. So have you all seen this, or is this the first time you're taking a look at these figures here? First time, perhaps.
This is the first time.
Okay. All right. So I had a little advance on this, but on the left-hand side, of course, you're going to see the social determinants of aging well that we had come up with based on our feedback. These numbers are here in terms of what might have the most impact, and then how are we doing as a state in a scale of 1 to 10? And Anthony, I think you're driving there. Were you going to highlight something for us, or talk to us about the scale perhaps on our survey? If we could go back 1 slide. Please.
Sorry about that.
That's okay.
Jeez.
There we go.
Yep.
Did you have the information from Will on the scale, or I can speak to that, Anthony, if you don't have that in front of you.
Frankly, Chris, I think it might be better if you speak to that.
Perfect. I didn't know. I saw your cursor moving there. So obviously on a scale of 1 to 10, we've ranked 10 as those things that have the highest impact. And then we want a higher score to be doing well in our state. And so as I looked at these numbers, I started to look on, okay, does that make sense in terms of impact? But then as I looked at the numbers, the lower numbers are areas where we think we're not doing well as a state, if that helps orient all of you. So let me start there, and get your feedback. Economic situation, that was a 10 for all of us. Rob, you've got some comments. Why don't you jump in on that or anything else you're seeing here?
Just because
you're off mute, so I'm going to call on you.
Just because I was just going to say, just because I accidentally unmute, he's calling. It's like we're in a law school class or something. I actually was just going to ask if for just a small request that whenever this information is shared, if we could do this either by highest to lowest or lowest to highest, or even in alphabetical order, whatever, but with some type of organization would make this a lot more palatable. And with that, I would simply say, I think I could speak for this whole group when I suggest that economic situation is really much more of a broader category that could really contain almost all of these things. It's not, economic situation is a very amorphous term, but it's undeniably in America, in all of healthcare, right? It's not unique to home care, that your economic situation will dictate your outcomes.
Yeah. That's the framework. And then as we look towards, okay, well, what are practical steps that we look to implement? One of the discussions, well, I'll back up. Rob, your point is well taken. Apologies for, again, not getting this out more in advance. And what I will attempt to do is in my brain, sort through these numbers for our discussion here, where we ranked them. We'll go through those. And I think then as we look at what are our solutions, I was talking with Kathleen, well, of course, to your point, that's the huge driver, but what are we looking to do? Melissa, as I thought to, the plan that you and your agency are working with to look at the number of people who might qualify because of their economic situation, that was one of the things that it's like, well, what do we do? Well, is it okay? Well, do you want to speak to that again, to the plan that you and your agency have?
Absolutely. So we have been fighting as a state agency on aging a wait list that just is unrelenting, and we've added additional dollars over the years and been able to slow the growth of the wait list, as well as increase the speed up the time that people are able to access services. So we've been successful with additional funding in both decreasing wait time and increasing ability to serve, but we see the wait list lingering on yet despite all of that. And so in looking structurally at what else might be at issue here, we discovered that there's a significant portion, and we think around a third of people that we're currently serving are on our wait list that are eligible for Medicaid. And what's unique to our service system from the state array of services is that it's duplicative of services in Medicaid. And I think that maybe is a piece we could tease out otherwise, is, where are we duplicating service arrays? Looking at making increased efficiencies, we're looking at how do we help those individuals that are Medicaid eligible access Medicaid in a more streamlined fashion, really structure our system to be a true safety net and one that's available to individuals that really have no other insurance or a third payer option to help them access the services they need. So the third can look a little different depending on the service array. We know in personal care, and that's probably most meaningful to this group, it's at least 35% that we could be serving on Medicaid, and then hopefully leveraging additional dollars to serve additional individuals, barring all other complications like workforce needs. And then we also see that in other service arrays on our wait list. So the goal there is just to better leverage Medicaid and then look at what other funding opportunities might be accessible to this population. And if there's anything else you want me to add, I'm happy to, Chris.
No, that's great. Thank you for
Okay.
that.
Mhm.
Allison, were you gonna chime in?
No, I was just going to ask, in looking at this, obviously, it's a fairly extensive list of things. I just, strategically speaking, were we looking to kind of focus on our top 5, or are we looking at, is there a way we're categorizing? I'm just kind of curious, strategically speaking, what our take is.
Yeah, I'll expand on that. I'll die on the sword for this one. I'm not totally sure what it is we are seeking to get out of this, right? Like when this subgroup concludes, what is it that we are doing? Are we submitting a series of recommendations to the greater committee with some type of like report about what our sense of the state is on these issues and where we would address them, and then furthermore provide any level of recommendation on how to address them? Because those are I just want to make sure that I'm in a right mindset for you about how to think about this information, right? Please forgive if that's a super rudimentary question that was supposed to be kind of already understood, but I'm never afraid to ask stupid questions. So thank you.
Thank you. I was talking with a young man over the weekend who's looking at a career in healthcare, and I said, you can't ever be afraid to ask the questions, because we're all thinking them. And the brave leader is the one who stepped up. And so thank you, Rob. Those are the same questions I have in my mind as well, as we're looking to lead this. And I think you and Allison, yeah, you're on the right spot. What's our strategy here? I think it is that to inform the discussion on social determinants and make recommendations of where the state could have an impact.
Insofar that data and actual information allow us to, I guess, yes, is what I say, right? Yes. I caution like over editorializing.
Right. Where we may not, we understand people's socioeconomic situation is, paramount, and social determinants are drivers, and that we are dealing with systems that historically have, had racism in them, or there are inequities in there. Where do we think we could have the actual impact? And I guess when I went to economic situation, I had the same thought as you, Rob, and that's why, Melissa, I turned to you, because what programs are successful where we might say we need additional funding for these programs that we have, and we have some data on them and how they work. So I do think, Allison, too, also let's tackle our top 5 in impact, and then let's look at maybe our worst things also in the state where we might be able to drive better. Rob?
Chris, can I suggest just one, please forgive me, could we have could we write down like a statement, right, of what it is like, so if we were trying to determine what the social detriment impact is on racial equity, racial equality, how is the rank of what we're about to do, like toward what thesis, right? Because that's really important, I think, for staying on track. I think it's really easy to get tangential on especially kind of social issues. This is a social issue. This is as much a healthcare as is a social issue. And so it's really important that we kind of have a thesis statement that I think can kind of help dictate how we rank these, since inevitably in all social issues, there will be editorializing and needing to just kind of use your best judgment. Does that make sense?
Yes. Yeah. Others?
I'm happy to write down a statement if we'd like, and I can share it after the fact.
That would be great, Rob. Yes, please. And I'm, speaking right now, got my pen here.
Okay.
So, where you've kind of brought us towards what's our strategy, what's our goal. If you could do that for us,
Yep.
That would be great.
So how about the goal of this group is to first determine the ranking of issues affecting, I guess I'm trying to provide us a certain level of specificity so that we can accomplish something rather than try to cover so much ground where we accomplish nothing, right? So does anybody have any suggestions
on successful aging?
What?
The most impact on successful aging, kind of how we have there.
Okay.
And then, like you had said, provide recommendations, right, to the overall committee. Is that where you were going?
Yep. And so then we would just get into the list. The number one thing looks like it's economic situation.
Yeah, I mean, and to your point earlier, Chris, I mean, most of the things we have under here are all part of the economic situation. So let's assume that we could probably say that the economic situation is probably, with all these subgroups below it, the driving factor.
Yeah.
But then picking those subgroups that would have are most in need, or we think are the most important, and also those subgroups where we can possibly have recommendations that we can actually affect some change on. There's obviously things in here where, we may have recommendations, but the ability to actually affect change would be pretty difficult for us to do. So I think also just having that in mind is like, not only what's most important, but what are we most likely to actually be able to influence and create more positive outcomes with.
So number one is clearly food security.
Yes.
And it gets mixed reviews in terms of state doing well on the issue. It's actually relatively high, right? Versus all the other things.
It's closer to like a 7 out of 10,
yeah, we'll say biggest issue, but government may be doing okay. How's that?
Yeah. Yeah, and then where we jump to down there, lower is, spousal and family support. 8.8. Nutrition and physical activity, workforce and transportation.
Yeah. So that probably warrants a little bit more discussion, right, on ciphering those out.
Yeah.
And Allison, that's where you're saying, are these top 5? Are these the top 5 that we should have and do something?
Exactly. Like, they may be the top 5 that we ranked, but are they also the ones where we as a group collectively can have the most, impact on? I mean,
And again, I'll go back, Allison, I think it was Rob who said, kind of economic situation tempers all of these. So just for the point of clarification, Rob, thank you for that.
Sorry, I'm vigorously writing this down in a list form so that we can all see it very easily and weed out some of the other noise.
That's great. And then Melissa, I think one of your points that you had made earlier is it workforce and transportation are going to be tackled by other subcommittees?
I would expect so, yes.
Okay. So does that mean we chop those off of our top 5 that we look potentially to strategize about and then add some others?
Well, I certainly don't think that we couldn't find, you know, even just at a like baseline level for social stuff, like on workforce, for instance, we know it's predominated by women, right? The workforce for home care is female dominant, and that is worth discussion. I think I don't have an opinion one way or the other or how to suggest that we discuss it, but I wouldn't want to write off workforce based on this, because there is a relevant discussion to be had about that. And when you think about rates and things like that, you know, it's not, you can go down this road, right, of finding how all these things are interconnected. So I'm not an expert to navigate us down that road individually, but I do think it's probably worth having on the agenda.
I agree with Rob here, and certainly I think there may be other groups addressing some of these issues, but if it's an important enough issue, I mean, obviously the perspective with which we're addressing it may be a little different, so we may have different kind of ideas or thoughts, but workforce is, you know, obviously one of them that's clearly important, but yeah, I think it's just the perspective we're coming from.
I think that's great. And so we could keep those there as our top 5 from the lens of social determinants and disparities or inequities.
And oh, Carolyn has her hand raised. I'll be quiet.
Thank you.
If we move or recategorize some of these things, I really am concerned about, because it's very close in there too, about the memory care, because as we see people aging, and more are seeing people that are going to need this memory care. So if we're looking to the future, things that we really need to expand throughout the state, I believe it has to do with memory care and dementia. So if we move some things around, I realize that's like number 6 right now or something.
I think we should just include. I think we should just include it, Carolyn. It's the last one in the 8s. Let's just. It's the last one in the high 8s. Let's include it and see where it goes.
Okay, thanks. I think it's extremely important.
Yeah, we don't have to limit ourselves to 5, but to the point of what can we really tackle, I think, Allison, you were making, right?
Chris, it strikes me then that maybe the conversation should move into, do we think the state can actually do anything about these, and within what time frame? That would
exactly. And you know, to the point even of how are we doing, Carolyn? Are we doing well with memory care? Is that a real opportunity?
I believe that the state is making some progress there, but we do have some unfunded programs, like the early memory loss program is totally unfunded in the state. So maybe we need to find some money to put into that. I know they are funding right now the adult day services, which tends to be more advanced cognitive loss, but the early memory loss, and we're seeing that more and more now in the senior center environment. We see people come in here and they don't know where they live. They don't know where, you know, and they need more care, and we need to put them in, you know, kind of put them away from the general population, but there's no funding for that type of program right now in Delaware.
Thank you for that. Yeah, I think Kathleen was saying, sharing a similar thing, and especially as people had not been connected over the last year and a half, and coming in and seeing where cognitively they were with some of their memory loss. She was saying the exact same thing. Melissa, I think you were the one who added this for us as one of when we were talking in our last meeting. Do you want to chime in here too?
Sure, just in that I agree that it needs to be a priority, both in funding, and that certainly from our agency, one of the reasons we're looking for efficiencies is to squeeze out some extra funding to really look upstream at these social determinants. And so it's very much a goal of ours to get there. I'll just say from the state perspective, we are in the process of recruiting and filling for the first time in a very long time a program person dedicated to developing this programming. And one of the things that we're interested in building out is a dementia-friendly community, eventually, hopefully, to envelop all of Delaware. But so yes, it's a priority of the state to be able to start to look at funding alignment and be able to, find the efficiencies I discussed earlier and look to develop and foster and support a network and a system that hopefully is includes other partners other than the state to figure out how do we support those individuals in need of memory care and dementia. And I'll just hopefully not a political vein, but just mention that there's federal legislation right now that's out there looking at developing systems of care for Alzheimer's, for individuals suffering with Alzheimer's. And so there seems to be, even at the national level, some effort to really to provide funding, to Carolyn's point, behind this kind of programming.
Can I just add something from the 50,000-foot level about all of this, Chris, which is that it's just funding, right? On all of these issues, in practical terms, if I was an advocate for all of these things in the halls of the legislature or in Congress, what we would be talking about is just funding, right? So I guess my question for all of these programs that let's say we've identified, here's what we've identified. Access to transportation, availability to workforce, nutrition and physical activity, spousal, familial support, food security, and memory care. Well, where in the budget does this take place? And then there just needs to be discussion about whether they need more money, right? I mean, isn't that what we're talking about here? I think if it all comes back to, if you're telling me it all comes down to funding, it's not bureaucratic, not administrative, it's not, it's not, I suppose workforce issue could be a little bit multi-tiered, but does kind of come down to funding, I think. And by the way, that is consistent with Melissa just said, which is Congress, they're not talking about programming. I mean, there's some talk, but a lot of it is funding. The reconciliation bill has $180 billion for home and community-based services in its original form. Don't quote me. I don't know if it's since been lessened, but the point is that the highest people in the land believe that funding is of huge importance to the moving the ball forward. I won't call it a resolution, moving the ball forward. Does that make sense? I mean, the narrative is important here.
Yeah.
I want to say yes, and I think that there's also room for innovation here, maybe particularly in this arena, in that we need the funding because we need the funding to support innovation. But I'm also curious and interested in where we can learn best practices, but also new and promising practices and innovation in different areas of programming where we don't currently have adequate resources.
So, and what we have to bring to this conversation too is where are the disparities and inequities? We may be innovative, but are we innovative across all of our communities? And Carolyn, to your point, are we doing things in a preventive manner? And then also programs that are more advanced.
Well, it strikes me that the language then for our report for the committee will say as much. It can say both of those things. It can say that there's room for growth from a financial and resource perspective, as well as an innovation and kind of thought exercise perspective about best practices. And if they want to move that forward, then they'll put together greater minds than ours, and they'll move it forward, right? That would presumably be kind of how we would communicate this conversation, I think, right? That's what we're doing, is figuring out what we would say in the final report.
Yeah.
I think also in the final report, there needs to be something said about, because many of these programs are funded, but they're like the early memory loss, there's absolutely no funding for that anywhere. And so if you don't get foundation support for that, you don't have it. And it's an important component. So it's all in the money, give us the money so we can run the program. So there's got to be more money out there somewhere for it.
Mm-hmm.
Yeah, I would be willing to bet that the numbers in how is the state doing on this issue, and providers and agencies and whoever were answering the survey thinking about that, in large part, it was about, being funded is different than having sufficient funding, as Carolyn pointed out.
Mm-hmm.
And I think probably I'd be willing to bet these numbers reflect that thinking to an extent, that these are areas that maybe there are things, but they're just not adequately funded. Or for instance, in the workforce, I know this is a self-serving plug, but some of these pay rate or the Medicaid rates, they haven't gone up in a decade. We're not talking about like, that in of itself is innovation. Raising a rate after a decade is innovation. So anyway, count me in Carolyn's court.
I wanted to ask too, Melissa, as we're talking about, so Carolyn noted, Rob noted, Melissa, on the dementia-friendly communities, is that plan mindful of, hey, we need to get into what might be traditionally underserved communities as well as across, are we making that recommendation with the social determinants lens?
I would advocate that we do as part of this subgroup. And certainly the concept of dementia-friendly community is that it's community centric. And so it should vary by community, what avenues participating entities, and that's businesses, transportation, et cetera, they're going to have different interventions depending on the community needs and just the differences that present themselves in our communities in Delaware.
Okay. That needs to be part of our recommendation. You mentioned transportation, and that was one of our high here, and I will just Kathleen and I were talking about it a little bit. I think because looks like as we rank, okay, a 5.75, we're doing okay-ish about that. But I think in all of our discussions, we talked about the importance, and I also think about the social determinants there. If I have enough funding, I've got a smart device, I know how to use it, and I can order an Uber and get where I need to go. That's one thing versus if I'm not, and I have to call DART and work with them and get a ride and wait for them where I need to go. So transportation, thoughts on that? That was one of our, I'm working back up the list backwards from our top 6 now.
I'll jump in and just say that as a member and a co-chair with the services and isolation subgroup, I think at our very next meeting, we'll have a representative from the Department of Transportation visit and speak with us. So I'm taking from that, it's likely the interest of that subgroup to take on transportation as one of its more primary priorities. I will absolutely confirm that with the subgroup going forward. But if you're, if we want to kind of divide and conquer, I think transportation looks like it's going to go over to services and isolation.
Does it make sense for us to learn a bit more about food security? I mean, food security just, had a much higher number than even the second ranked one. So in a future meeting, Chris, if there's someone of any expertise that's not currently in this group, maybe it'd be worth having them on to talk to us a little bit about it and kind of specific issues.
Rob, thanks for that. And that's, yes, I think that's great. And that's what we're doing, to your example, Melissa, with transportation, calling on the experts that we need to hear from. So yes, I'll note that here, and we'll work with Will and team to set that up. Carolyn, yes.
Okay, I just have a couple of comments. Number one, there is an expert on nutrition, and it's the division. So I would ask that Melissa might share some of her nutrition folks or something to address the food insecurities, because they have a great staff there that does that. I want to go back just a little bit on the transportation issue. Years ago, I worked with the Department of Transportation, and we tried to get funding for a project called Wellness on Wheels, because there's a great difficulty in getting the older person to their doctor's appointments. They can't maybe ride the DART bus, and it's a huge issue for those who are homebound and need special care. So we were applying for a grant, but we didn't get it. But it was mainly to help people get to those doctor's appointments and everything, because that's another subset of the transportation issue.
I appreciate that. And I think we did hear, and it sounds like I guess the services and isolation committee would also hear from the group that is in Sussex County that's doing a lot of great work with individuals volunteering and helping out with that. But wondered if we might make some recommendations toward that committee as well, just to be thinking of if there are recommendations that come out for transportation, that they would be mindful as well of specific underserved communities. Melissa, did you have a point you're gonna?
No, I was agreeing with you that there's another potential overlap there, although I'll say we haven't in that subgroup gotten far enough from able to offer next steps. So I'll parking lot that for the conversation and bring it back to you guys.
Okay, how about Carolyn's wisdom on your team, and would you be able to perhaps help us out for our next meeting with somebody?
I appreciate the vote of confidence. I think we have, we're knowledgeable about the nutrition supports that are available through Administration of Community Living and through the Older Americans Act. The thing I would bring to the table as well, though, are partnerships that were forged early in COVID and have continued since. And there was really so much strength and circling the wagons around food insecurity and making sure individuals were fed. And so I would actually like to revisit those partnerships and some of the coalitions that were formed specifically around feeding individuals. And there was really some really innovative and different ways that we got to the same place of just making sure that those individuals that needed assistance in accessing food and nutrition were given those opportunities. And so thank you for giving us that call out. I mean, we can certainly come to the table, but I think that if we could bring a couple of other representatives that were part, and certainly our meals providers are among that group, that were really helpful in addressing a new surge of food insecurity and lessons learned there. That could be, I think that could be a valuable piece to hear.
Okay. I have partners, the Meals on Wheels program and the Food Bank of Delaware. I know that we worked with them closely at Westside to do things at our health centers as well. Does anyone have other suggestions or any other partners off the bat right now? If not, it sounds like we have a few leads. And Rob, thanks for that good idea. We would look to do that for our next meeting. Okay, we have about 10 minutes left in our meeting. And there are certainly some other things that we identified as how is the state doing where we didn't rank ourselves very high. Can I go back one slide real quick, Anthony? I just mentioned workforce, which we did kind of say, okay, there's another committee looking at. But Rob, I think to your point, there might be something more, we said, well, let's keep this on the list. I think there's more to talk about in terms of social determinants there that we might want to explore. What about some of the other areas where we ranked ourselves not doing so great as a state? Does anybody want to speak to those? Anything that's jumping out for you? These would be the lower numbers in the last column.
I will address a little bit of the comfort with technology. I mean, we just went through all of this with people trying to set up appointments to get their vaccination. There was one series of it that said, go on the internet and make your appointment, do all this. But when you're dealing with people that are 75 and older, they can't do that. And so whether it's, it's their comfort or they don't want to do it, or, the lack of having an iPhone or a computer or something like that. I mean, we have to look at all of those aspects because there's a reason why that's low. And that's because the older people are not comfortable with it.
To echo everything Carolyn just said and add on, I think the intervention is going to be individual based, listening to a few different approaches taken over COVID to help older adults access information via the internet. The most successful interventions seem to be one-on-one tutoring to help individuals learn how to use a computer, learn how to navigate the internet, learn how to navigate these apps. We did try to look at ways of having kind of a very simple template and giving devices out, but the real solution is teaching individuals how to use technology. And that's incredibly rewarding once that individual learns, because then they have access to everything that you can access via internet and apps, but it's a high intensity intervention as well.
And so, we may have some recommendations there that we would bring forward, especially as we look at disparities in the communities that we serve. I think I see that as well too at Westside, as we are doing work with the marketplace right now, and it is open enrollment for the marketplace, and the value of being able to sit down one-on-one with someone to walk through all the different options that you have, and understand. So that maybe that's our recommendation as well, is if we're going to talk about technology, it's the guides through that technology if we're going to move people that way. Okay, any other thoughts on, hey, here's how the state's doing, and certainly there are some lower numbers in terms of education and those issues. I think maybe we have some of that in the access to services and isolation. Any other thoughts on this? The next slide then, Anthony, if we could, thank you. This is also our ranking, and a little bit challenging to sort out because we're all over the place in some ways, maybe, or maybe not. What would we recommend as we move this forward in terms of a time frame? What would make sense to focus on in the short term that we could make an impact on, or versus what would take a little bit longer? And Kathleen and I talked about this a little bit. We were kind of thinking short and medium, because once you start making a long-term recommendation, 5 to 10 years down, sometimes your strategy changes and there'll be another group. So we're thinking a little bit maybe what's short and medium term. Rob? And
defining that, because during a pandemic, if medium is 3 to 5 years, some of these can't wait 5 years.
Yeah.
Yes. And it's important to acknowledge the urgency, not just the time frame.
Appreciate that. Yeah, exactly. So short was within the next year. I think medium was 3 to 5 years, and long was after that. So Rob?
Yeah, and I think in whatever we report out on too, that it's important that we not speak kind of in absolutes. I think that there's a tendency, if I could just be frank, generally by state governments, Delaware is not unique, about not really, it's like nothing can move forward until that thing is finished, and we can't wait. We need to make progress is incremental, year on year, you can't figure an end game for every single program, every single budget line, or every single appropriation in 6 months. You just can't, but you can move the ball forward on a lot of these things incrementally. So sorry if that's cryptic. It's just, like philosophically speaking.
It's doing something, right? It's the
it can't just be ideas. You gotta start doing stuff.
Yeah.
Can't just wait for completion. You gotta start doing stuff.
It's what my former boss used to say to me, just do it, Chris. So here again, apologize for you all not seeing this earlier, but I think where we would say, and where we need to take our discussion for our next meetings, is what do we need to just do immediately? And those are the areas where some of you have answered. These are the things that need to happen in the short term. And so if we went to the bottom of our list and worked back up, Carolyn, there's memory care and dementia friendly communities, Melissa, so that from our earlier discussion, hey, we've got these programs, but if we could get some funding to make this happen, or move these things forward in our communities that are underserved, with that lens of getting rid of disparities, that might be something that we talk about. What else is jumping out for anybody here? Allison, were you gonna? No, everybody's absorbing. I'm reading the crowd here. Is it food security? If we're gonna hear more about that, understand the importance there. And certainly everybody's, where we said we're doing the worst is workforce. And we need to do there. Okay, I'm gonna open it. So I know a few people are juggling things. Mr. Ware, do you have anything that you would close us out with what's your perspective on all of this? We'd like to hear from you, sir.
Sure. Well, I think it's a really good idea to get some more experts in, understand some of these subject matters a little bit more in depth. I think I'm just kind of taking in everything, understanding like what the committee's role is and how we formalize a plan to try to move the ball forward. So it's been a good first meeting to take all this information in.
Great. Thank you. I think to your point, we'll have a little bit better definition on what we're looking to move forward. Mr. Latin, sir, how about you? Any thoughts? I appreciate you stepping up with some ideas on helping us define and how to, like Mr. Ware said, move the ball forward.
Yeah, no real final thoughts, except that I hope that whatever we put together in terms of a report is, a contribution, less a prescription, right? A contribution to a bigger discussion that probably warrants more focus than whatever our tiny subcommittee will be able to accomplish in the short term, if that makes sense.
Yes. Fredericks?
I want to go back to, maybe I misunderstood you in the beginning. How many people actually responded to the survey?
I think we had 6, so not all of us.
Okay,
Yeah.
so how many should have responded?
I believe on our subcommittee, we have 8 potentially.
Okay, so,
That's a
okay. So
majority.
it's,
That's a credible amount of responses.
that's right. I thought he said 4, so that was going to be about 50%. So I'm feeling more comfortable now that I know that we're there about 75%. So I think I basically have shared my areas of concern. Of course, but since we are a nutrition provider, that is one of my areas of concern. And of course, since we are a memory care unit, that's also one of my areas of concern.
Thank you for that. Ms. Sullivan.
Yeah, no, I think it's been a productive conversation. I think it's probably important to circle back, as we've all discussed, and really kind of hone in on what those top 5 things are, and at least have them. I know Rob's going to have our working thesis, as well as hopefully those bullets of what those things are. Because as we can see, it's pretty easy to kind of to get pulled in a lot of different directions, and unless we kind of continue to circle our wagons back around what we can do, I think I mean, that's my priority, that coming out of this, we drill down on those things.
Excellent. Thank you. Ms. Clark, anything? Like she's balancing a few things. Ms. Smith, would you close us out, please?
I'll do my best. Other than just agree with everyone what they said, I have a couple of follow-ups to that I owe you all in terms of rallying the group that got together around food insecurity, and also it looks like verifying the crossover issues of the subgroup for access to services and avoiding and decreasing isolation. And so to confirm that we'll be taking on transportation in that subgroup, so we can kind of rank it lower on ours.
Great.
I don't know if that was a closeout other than just a summary of.
It's good for our action steps. So we have action steps. Thank you. Thank you all. No, this was a quick meeting, but just really appreciate you all again on a Monday morning. Though a number of you also have 11 o'clocks. Anthony, thank you for driving. DTI, thank you for supporting. We'll get another poll out to see when we'll meet and get back together. So thank you all. If we don't talk before the holidays and everything, for me, a Merry Christmas, but however you all are celebrating, have that great time and a Happy New Year, and appreciate you all. Thank you so much.
Happy holidays. Thank you.
Thanks very much, everybody.
Thank you. Thank you.